Welcome to the overview of the CurrentCare portal and CurrentCare Population Explorer tools. We're going to start with a quick overview of the website, currentcareri.org, so you can see what information is available to you. So there is a provider login button here at the top. We do recommend that you bookmark the site portal.currentcareri.org, but if you do forget, you can come here and click on that button to log in after you have set this up with the CurrentCare team. So please do, if your organization has not worked with us already, then please contact us. You can submit a registration form to get started. Once we have gone through all the steps with your organization to get started, then you will be given credentials to log in here. Under the providers tab is a training link. So I just wanted to mention that really quickly. Please do use these as much as possible. We have live webinars or a recorded webinar, and we also have materials based on each tool. So for the CurrentCare portal, this allows your care teams to view clinical data. You can see a quick tips document or learn about search and navigation on the screens. You can do that using a video, or maybe just you want to click on the training slides and if you're not up for watching videos. So you can choose how you'd like to take the training. We have that for the portal, then Population Explorer, also for a panel processor and the HIE admin tool. These are just for certain individuals at your organization who will be uploading your patient panel or your list of patients or clients. Or if you are an HIE administrator, then those are authorized individuals at your organization that manage access to CurrentCare. So if you're either of those, then please view those training materials as well. Okay, so let's jump right in. So we have one CurrentCare portal website that allows you access to multiple tools. So this is pretty exciting. So you don't have multiple usernames and passwords. You can just come in and view the clinical data for your patients here under this patient search section, or Population Explorer. If that's something that your organization has set up with us, then you'll be able to see who on your panel of patients has had encounters recently. And we'll show you a lot more about that in a few minutes. And then you also have access to any other tools. So if you are an HIE admin or someone who will upload the panel for your organization, you may be given access to the panel processor or the HIE admin tool. There may be other tools in the future, but there's also a user guide and help here. So first we'll start with the patient search so you can view the clinical data. I'm going to enter a test patient. All of this is test information, so you won't see any real PHI. You can paste in this information as well. I often like to copy things from place to place, so I make sure to get it right. But just do note, if you do paste into this date of birth field and you leave a space here at the beginning or the end, you will not be allowed to move forward. You will get an error that this expected date is not correct. There'll be a little red underline here. So if it's really hard to figure out what that means at times, but if you just remove that space, then that error will go away and the little red line will go away as well. So if you're copying and pasting from place to place, you can put spaces in the names, but in the date of birth, it will stop you from moving forward. So the required items are first name, last name, and date of birth. You could put gender or even social security number. That is optional. You don't need to do that. But it will help match to the patient. If we have received a social security number from a data sharing partner and do it enter in here, then it might help you match. So there are a lot of patients in here, and they're not all from the CurrentCare community in the Rhode Island area. There are some throughout the country. There are other affiliates that use our health information exchange. And so you might see patients from other states. So please do verify not only the first name and last name and date of birth, but also the address to make sure that you're clicking on the right patient. You can see the match score here will tell you if it's a probable match, or if it's less probable, then you'll see a lower number here. Maybe it's just a possibility. Maybe the name isn't even matching, but we're just showing you something that might possibly be similar. And then what you do is once you've selected that this is the right address for this patient, you click on it, and then you'll be given a list of applications to open. Right now, the clinical information is the only one that you'll be opening, but there could be other ones in the future. If we have a consent tool that we'll be going live with, you will see that here as well. So please look for trainings for that going forward. Once you click on the patient name, it will open up our in context tool. So this is all the clinical information for that patient. See how that's highlighted here in yellow? These are all those other tools that I could switch to if I would like, but mostly I'd probably like to just collapse that panel so that it will give me more information displaying in the clinical data tool. The other thing I want to have you do is just get in the habit, at least in the beginning, maybe, of expanding this menu so you can see all the tab names. You can always collapse it or leave it collapsed if that's okay with you. But for now, for a lot of new organizations that are using it, they like to open this up so that I can see which tabs I want to be clicking on. So you land here, default, on the clinical data tab, which shows you the encounters for your patient. And then there's health records, structured documents, and others. So we'll go through each of those. Then I want to just show you these tabs on the left here. So patient information is the demographics for that patient and even next of kin information. So I know a lot of you are often asking, like, how do I know what, the next of kin or how to contact any information about my patient's family members or other next of kin. And so if we receive this information from data sharing partners, then we will display that here for you, as well as their email. And what isn't shown here is phone numbers. So you can find the most recent information that we've received from our data sharing partners here, and you can be able to contact your patients or clients that way. The medication management tab we'll go through a little bit more in a few minutes, but we have last 90 days, all medications, as well as the PDMP prescription drug monitoring program are under medication management. We have a care coordination tab so that you can see where your patients are being treated, which organizations have a treating relationship with them, or even which provider name they have provided. So this data sharing partner or this organization has provided this provider's name as the primary care. So you'll be able to coordinate with lots of different organizations who are also treating your patients. And then we also have social needs data. So if we do receive information about social needs, food insecurity, housing insecurity. Here we have disappearance and death of a family member. If we received any of those Z codes from our data sharing partners, then we will display those to you here. And then we have a My Patient Summary tab. This will show you a way to customize how your view will look into the system. So this is really exciting because if you're someone who really wants to focus on something like medications more than anything else, you can go to the medications tab and pin that to your My Patient Summary by clicking that little pin next to the tab. You can do that on your last 90 days. You can also do it on your All tab and make sure that that's pinned. Or you can do it on any of the other tabs. So I'm just going to click social needs data and pin that, and now go back to my patient summary, and you'll see that you now have those two tabs, those sections pinned here under my patient summary, so that if that's where you're going in and you want to customize and see that first, you'll be able to do that. Or you can move them around with this little drag bar here by just dragging them back and forth. That little drag pointy icon is how you do that. Or if you want to unpin it, then you can just click the pin again, and that will take that off there. You can pin up to 8 different tabs in your My Patient Summary. And you can also make the My Patient Summary or any of these tabs your default by clicking on User Settings. So this tab order is what's showing here. If you want to change that order, then you just click the arrow to move it up to change your My Patient Summary maybe to be your default, and this is where you're going to land. So now every time you come in to the CurrentCare portal and you search for a patient, the My Patient Summary will be your default. So that's pretty exciting. We're really excited that you can customize your own view and be able to see what you'd like to see. And you can do that for any of these clinical data tabs as well. I didn't pin any of those, but you can certainly do that under encounters. One I recommend is the hospital encounters tab for those of you that need to work on hospital information. This is a really helpful way to sort of filter down and see only the hospital ones and not all of the outpatient ambulatory encounters that are happening. So here under hospital encounters, we actually show, the source, where they were, the date they were admitted, the length of stay. You'll see over here That's not on the outpatient tab, that's only here on the hospital tab, as well as the admit reason. So we definitely recommend that you don't just use this all encounters tab, that you also click in or pin this hospital tab, because it has these extra columns in there that are not on that all tab. So it's really important for, at least some of you I know have told us that the admit reason is really important to hear. What is the patient saying that they're the reason that they're there? And then also any diagnoses that the hospital has provided. This is a test environment, so those aren't populated here, but in the real production environment, you will see quite a few diagnoses that are shown there as well. So you'll be able to piece together where that patient was, why they were there, how long they were there. And then you can go find more information about that visit. You can look up health records. You can see different labs or radiology or even clinical notes. So I'll show you a little bit about those for each one. So this is a lab value that I've opened up. I can scroll through each one of those using this nice arrow, so I don't have to close it out and then open up the next one. I can just go through and see what those specific documents are. So you can also search. So maybe we want to do something like a CBC. I'm looking for a history of CBCs. I can click on that now. You see I only have 7 or 8 values here, different reports. So now when I open that, I have 7 that I can click through. So I can quickly see over time what has happened with my patient's CBC values just by clicking this nice arrow at the top. You can see abnormal values. If you hover over those, it will tell you this specific one is below normal. And then for radiology reports, I'm just going to clear my search because CBC won't work there. You'll see that you can open up radiology reports and view the report of the results that came from this radiology test. You will notice that in our test environment, you'll see a lot of these image icons over here on the left. You will not see as many of those in the CurrentCare environment today because the CurrentCare data sharing partners do not send us images right now, but that is a potential future project that we will have, that for the local Rhode Island imaging facilities, you may see images, or you may actually see them today in some of the border states. So Connecticut, for example, you might see some images come through there. So if you're in need of viewing the actual image and you see this, then you can click that. We'll actually open a new tab and show you that image directly. And of course, you can see the provider's ordering name for all of these results as well. Under clinical notes, you will see discharge documents for our data sharing partners here in Rhode Island. So often you have to click this little view report at the top to be able to view that, and then it will show you. We don't have ambulance reports yet here in Rhode Island, but we have discharge documents from Brown University Health or discharge summaries from multiple hospital systems. And this is where you will find those here under clinical notes. And we also have structured documents. So one thing I did forget to mention, I'm going to say, is that we do have a data guide here on our website. It is something I do recommend you take a look at. currentcarei.org/data guide is always the URL you can go to. And we do explain all of these there. So if you're looking for a quick reference about where to find specific things, you can look in there, and you can also see which organizations are sending those. So for those structured documents that I was just going to show you, those are our care summary documents, or CCDAs. And so you'll see here that we get those from Brown University Health. We're waiting and estimating that other organizations are going to be enabling those soon. The place that you will find those is under the structured documents tab, and then on the HIE tab. So there are 3 tabs under structured documents. All will show everything, including HIE and national networks. So the HIE ones are the local ones for your current care organizations, where you'll be able to see a summary document from that organization in a structured way. So it will open it up. We are hoping that these are going to all be based on one episode. So you will be able to see the specific encounter details, where that patient went, what facility name they were at, and why they were there. So that is our CCD document that also shows active problems, active medications. A lot of this information then we then pull out and show you on other tabs. So you can view it here as a structured document, as a CCD of what happened at that encounter at that organization. And then we will pull out that information and show it to you under other tabs like allergies, problems, immunizations, Soon we're going to have vitals that I'm showing here. So there is this test patient doesn't have any allergies that have been pulled out, but the problems have been pulled out. So you're able to see from those CCD documents from all these different facilities, what is the problem list. And what we do is we show you each problem here, along with the code that we received with it. We show you the first reported date, the last reported date, and which organization it was last reported by. So we're hoping that you'll find that useful, that we will roll that information up for you and make a somewhat more simplified list. You can also sort by any of these. You can search, you can filter on all of these by clicking on the header for each of those columns. And then medication management, I know I mentioned that quickly. So we have those last 90 days. This is our test data is a little bit older, so there aren't any in there, but you'll see here under the all medications, we have a medication that has an arrow here that will show you multiple instances of that. And it also even has an orange indicator. If you hover over it, it says the dose or the provider has changed. So we'll show you the generic name, the medication name, and then this dose column, you'll see here that the medication dose changed 3 times. And you can see the dates when that started or was last reported, or in production, you'll actually see the provider as well. So we think that you'll find this useful, that you can roll up. It will start off rolling up as collapsed, but then you can also see the more detailed information about what has happened with that specific medication. And then for those of you that have worked with the CurrentCare team to get PDMP access, you may see data here under PDMP. That everyone will see the tab, but it will not have anything populated in it until you've worked with us to get that set up with you. We've set up a couple organizations now. We're just starting to make a list of others that are interested going forward. So if you would like to do that, please do let us know, and we can help you with the next steps for that. Okay. The last thing that I want to mention is that if you have any feedback that you'd like to provide about whether it's the clinical data for this patient, or maybe it's that there are multiple patients named Anna Cadence and you think they might want to be consolidated, there's duplicate records basically, you can click on these 3 little dots in the top right and click on feedback. And what that will do is send information to the CurrentCare support team about this specific patient and anything you want to put in there. So you can say a patient information issue, or maybe you have an enhancement request or an application issue or feedback, but it will send this specific patient with it so that you don't have to include that in there. The PHI is permitted here to be able to submit that. So we definitely recommend that you take advantage of that. It should be a pretty quick way for you to provide us with some feedback. And then the last thing here is that the My HIE admins at the top, this will tell you who your HIE administrators are. This is who is able to help you if you are locked out and not be able to reset your password, or if you need something changed, like your name change or something like that, or added extra services. You can ask these people to do that. So I do recommend that when you get access, that you do just take a look at who your HIE admins are, so that you can contact them if you have more questions. Okay, so that's our clinical data. The next thing we're going to look at is Population Explorer. So this is based on your specific panel. The patient search is based on who you're searching for and who you need to view information, maybe a new patient, or you're looking for a specific lab, or someone's coming in today and you want to see where they've been recently. That's where the clinical data information will come in. The Population Explorer is when you want to know who on your panel has had a recent encounter. What this looks like is, once you open it up, there's a detail view and a table view. If you click on each of these rows here, they show you an encounter that has happened for a patient. So you can quickly see the patient's name here, the admit date, what type it was, whether it's outpatient or inpatient, or what facility name it was. And then once you click on it, you'll see a lot more information here in this center pane that will show you the patient's demographics, their MRN number that you've submitted on your panel. So hopefully that will be helpful to you to have some information that's come in on your panel. Like for instance, if you choose, you can submit things like a group name or a location, or even insurance type. that you've submitted on your panel, then we can display that here for you so that you can make sure that you're following the right workflows based on what that information is for that patient. And you can also filter on each of those fields, which I'll talk about in a little bit. But while I have this encounter highlighted, I just want to show you that this is where I see the selected encounter details, the admit date and time, or even a discharge date and time, if that is in there, even a death indicator. So if this patient is now deceased, you will see that in there. Lots of information, including things like what the insurance was on that ADT message, the admission, discharge, or transfer. The patient class, whether it's outpatient, inpatient, or emergency, the patient's complaint. Again, we saw that in the portal, and now you can see that again here. And then the primary diagnosis code and description. You will see those here as well. Other things are included, so we will now summarize for you things like aggregate details, whether they've had inpatient, outpatient, emergency, or observation visits over time. And so you'll see here that this patient has had 1 outpatient visit in 30 days and 2 in 60, and then 3 in 180. I do want to just caution that our new system is still building up this ADT data. So you won't actually see a large history in here yet, but this will continue to grow. And you can check that data guide to see when each data sharing partner, when each hospital has gone live and is sending in this information. But over the last 30 days or so, these should start to be really accurate, that we've been getting data from most of the hospitals in Rhode Island now for more that time. So you'll start to see this information build out over time. Okay, so let me show you how to filter this information down, because you will now start to see that there is a lot of information in here for your panel. There are a lot of encounters, and a lot of them are ones that maybe you and your role don't need to look at this time. So it's really important that you learn how to filter down the full list. So we're looking at 27 pages of test data here. And a lot of them are just outpatient encounters. So if you and your role maybe really want to focus on inpatient admissions or something like that, you really want to use a quick filter over here. So I'm going to load one just so you can see how quickly it is. I've saved a filter, and I'm going to click it, and then I'm going to click load. And now it's going to reduce the list that I see here from 27 pages down to just 1 page of information. So these are the encounters that I think that I want to act on. I've chosen my filters as an encounter type of inpatient, a group of a name that I've made up in my panel called Group City in our test, but you could call it your organization's groups, and a follow-up status of not started. So I've chosen at my organization that I would like to use this follow-up status that you see here at the top. The default is not started, that I have not acted on this encounter yet. But as soon as I do something for it, whatever the workflow is at my organization, I can mark that as in progress. And it just makes me confirm, yes, I want to change that status. And now this in progress flag will show to me anytime I come into the system, and it will also show to anyone else at my organization who has access to this panel. Sometimes you might have access to multiple panels, so you can see those panel names up here. And you can choose to change between them. But anyone who has access to my test panel here will see this status as in progress and will know that I'm working on it. And actually, next time I come in, it will actually load the last modified by me and my name here so that everyone will see when I edited that. And there's also at the bottom a follow-up status history. So you can see who's changed it from not started to in progress, or maybe even to complete. So I'll just mark this one as complete so you can see that it's just as simple as saying, yes, we did everything we need to do for this encounter. I no longer need to see that in this report. And then if I load that report again, that will go away and I won't see that encounter anymore. So a lot of organizations are finding that there's so much data in here and it's so powerful. There's a lot for you to see and use for treating your patients. But you definitely want to focus on figuring out how to start with a much smaller list. How can I take that large list of encounters and really filter it down to what I need to do in my role? Maybe I want to focus on just ED visits or other specifics like a specific provider name. And the way that you do that, I'm going to clear these filters now. The way that you make a filter is by choosing from the drop-down list here what I want my filter to be on. So maybe it's primary care provider. Maybe I have a primary care provider. I think our test data is called good. Let's see if that works. PCP is good. That's what it was. I can't remember. So anyhow, any way that you send in your information in your panel, this PCP name, you can add those in here. You can do multiple ones where you add specific providers' names, and then it will show you both of those, any encounters that have had a PCP name of containing either Good or Smith. And then maybe I also want to add that encounter type. So the one that I find that most people really want to look at is that inpatient or emergency, or maybe it's just observation in this case. So maybe I just want to find some observation ones for these providers. Whatever works for you, you can then quickly add these filters here, and then you can also save those. So when you click Save Current Filter here, it will allow you to make a test filter name. We'll just call that test 2. Oh, I already have 2. Let's try that again. Test. And so now that's a filter that I can always load here and pull that up as soon as I would like. I can also make the filter my default. So if every day or every time I need to come in, I want that specific filter to load, you can come in here and change your default filter to be that test 6, and that will load all the time. Also, you can make your default panel. I do recommend doing that. It does not start with that, so you have to choose what panel you would like to load by default, even if you only have one panel. So you might want to take a minute when you first get access and come into these settings and just set that default panel. And if you would like, you can then set your encounter type, your default filter as well. Okay, and then when you save settings, it does close the window, so you do have to go back into it by clicking on that. Okay, so we've talked about quick filters. So we've talked quickly how to select what you would like for your filters. What I do want to mention is that we do have on our website a list of what the fields are that you can then use for the elements are that you can filter on. So if you go to our encounter notifications page, here's a really quick picture of all of those different fields and all the different things that you can filter on. And then you can click on that here and it will open up a list for you as well. Okay, so that's quick filtering, and that's saving your own filters in your own login. So each individual person will need to make their own filters that way. We do have something called Configure Advanced Panel, and we will have separate trainings on these, and you can certainly ask the CurrentCare team to help you with this. This is a way for you to do much more complicated logic to be able to show which encounters you would like to see here. So if you need to say things like not encounter type of observation, or show me a very specific time frame, show me things on multiple panels that are together, that you want one report to show 2 different panels. So any kind of more advanced filtering there, you can use this advanced filter, and it uses functions like in, and, or, not. And we're not going to go through that here, but I can pull down a quick example of one. So you can quickly see that you can do in a panel, or you can say and certain admission dates and times, or encounter types that are, I click on encounter type, I click on this criteria, it will show me over here I've selected emergency and inpatient. So it's a much more robust way of running reports, or filtering down, I guess I should say. And this can be shared across staff at your organization. So this might be helpful where you want to come up with a more complicated query, and then you just want to save it for all of your team to be able to come in and choose that from your list. And the way that you choose that is actually from this drop-down list here. It's not a quick filter on the right. It's here under your panel, and then you choose what specific advanced filter you would like here. Okay, one thing I have not talked about yet is exporting out this data. So a lot of you might not want to use these tools. You might prefer to view this information in Excel or in a table view. I guess I should say there is a table view here as well. that a lot of you might find useful. We've been getting some feedback that some organizations are starting to use this. If you do use the table view before and not export, you want to come in here and show the columns that are helpful to you. So just click any of the drop downs on this table view, go to columns, and then just check off the column headers that you would like to see. Maybe PCP is really important for me. But when you first come in here, only a few columns are showing, so you definitely want to turn some things on and see what is helpful to you. But things like a discharge date might be really, really important to you, or PCP name. So I'll just add a couple more so you can see it then shows each of those. This is just a really quick view where you can see a table view. Let me clear my filter so you can see that. There's a very quick way to see how many which ones have which follow-up status, which patients we're looking at, who their PCP is, and what the dates are of their encounter. So this table view is a nice way to get a quick glance at the data that we're looking at, but you can also export it all out and use it in Excel. And there are some limitations here around sorting, things like that, that you may not find as useful in this table view. And in that case, you might want to export this information out. So one thing that you can do is export just a specific patient. That's called patient export. This one encounter that I've highlighted here, then I can click on patient export. It will tell me I'm exporting PHI and have to acknowledge that I understand that I need to treat that really carefully. And then what it asks is, which fields would you like to export out? And then how would you like to export it? So I can say select all the fields if I want all of them, or I can say select none and just pick a couple plus the demographics information. It really just depends on what you're looking for. I can even save that as my default. So the selected fields, really don't want these because they're not something I use. So I'll just save this specific list as my default. And then you can export those out as a PDF and also into Excel. So that's one patient encounter exporting. If you would like to export all of these encounters that are showing in your query here, so if I do this right now, I have 27 pages of encounters. I'm going to export all of those out. Or if I load a filter that shows me a much smaller view, which I think was just one page, and I click export here, that will export out just this one page. So if you're going to use export, do note that you want to make sure that you understand which filters you have applied at the time, and then you can go up to export. You have the same PHI acknowledgement, and then this option of exporting multiple only has an Excel option. So that will export all this information out to Excel for you. Okay. Another thing I want to mention is that there is a way to go right from here back to the clinical data for the patient. So I can't show this in our demo environment, but if you right click on any of these encounters and go to clinical information, then it will open up that other screen so that you can go look at the lab results, encounters, all of that information. So you right click from here and then go to clinical information and it will bring you right there. You don't need to log on to another place. That will show you directly all of that information. Okay, I think those are the things that I wanted to mention here. So please do note that our website has a lot of information about these specific tools. Encounter notifications is where you'll find out about the Population Explorer. That's the web-based tool. We also have other options for you to receive those encounter notifications in other ways. So please read more about those on the website. And then the clinical data, you can learn more about that here. We also have other options for you to have that same view inside of certain electronic health records. So if you'd like to read more about that and which ones we currently support, then please check that out on our website as well.